Hello, everybody. This is Dr. Hamid Elmir. I am an MD, MPH, and I am the host of podcast with Dr. E. At this podcast, I sit with the world's experts in health, education, and community development to talk about current health challenges and ask them to share their experiences, knowledge, and thoughts with all nations across the world, especially developing countries, so that we can learn from experts across the globe. Today, I have an amazing guest, and she is a clinical research scientist and public health expert. It's my pleasure to introduce Astha Bhatia today. Thank you for being with us today.
Thank you so much for inviting me. Thank you.
It's a pleasure. Astha Bhatia, BDSM PH. She is a clinical research scientist from New Jersey, USA. Astha is a dentist by education and also has completed her master's degree in public health from the US. She practiced dentistry in India for 4 years before moving to the US. She's been working in pharmaceuticals industry for the last 10 years. At present, she's working as a clinical research scientist and helps design and execute clinical trials globally to help make new drugs and therapies available for patients suffering from cancers, especially those with blood cancers. So thank you very much for all what you do, Astha.
Thank you. Thank you.
I'm sure our audience will have a better understanding of COVID-19 after today's show. You have appeared at other podcasts recently, also talked about COVID-19, and it's been changing too. I'll start with the question that a lot of people have and are asking is the knowledge about the coronavirus, such as its transmissibility, wearing masks, etc., has changed a lot and it's been rapidly evolving. Do you think people should still expect more changes in knowing coronavirus?
Yeah, that's actually a very good question, Hamid, and you as a medical professional know about it as well. Coronavirus has been there. The common cold is caused by a type of coronavirus. This is one of the newer coronaviruses, and that's why we call it novel coronavirus. Mm-hmm. It's so new that, we're still discovering about this particular virus. And since it's the first outbreak of this kind of virus, our knowledge is changing as we progress and as we get more data. And you as a public health professional know about it, how we kind of study, as the disease progresses. So yes, I mean, as we've observed, the pattern is changing. Whatever knowledge we're getting with the new data that's coming in, it's changing. In the US, initially, we said something about the directive was not to use masks and leave it for the healthcare professionals. Mm-hmm. That's changed now. So as we evolve, the knowledge grows. And, once we get the data and the analysis is done, more and more knowledge will come and we'll get stronger and better at handling this virus. So at present, our knowledge is definitely better than what it was in December of 2019. Mm-hmm. But there is a lot of stuff that remains unanswered. Questions like, you might hear questions like, what's the effect of hot and humid weather on this virus? Because the flu virus, we've observed that does not do well in the hot and humid weather. So right. What's that effect? What's the effect going to be of mutations on this virus? So all of those questions still remain unanswered, but I'm pretty confident with the data that's coming in. Once we do the analyses and we understand it better, it is going to evolve and get a better approach.
Well, thank you so much for the comprehensive information there. And as you said, it is, we still don't know, we know a lot about it as comparing to a few months ago, 3 months ago or so. But still there are some, parts of it that we still are looking, and researchers and scientists like yourself are trying to help people to have a better understanding of the COVID-19 or the coronavirus itself. And this leads me to the next question that is also one of those very common questions a lot of people are asking. that people and businesses are, desperately waiting for a treatment as well as the vaccine for coronavirus. And you've been doing research in pharmaceuticals industry. When do you think vaccine will be available, and how soon remdesivir, which is approved by FDA, the medication, will be available in the market, not only here for the US but also for the developing countries?
Right. So I think there are two parts to your question here. One part is the vaccination part, which is the prevention, just so that the common folks understand. Vaccine is something that is given prior to the occurrence of the infection. They create immunity, and it helps you avoid the infection to occur. As you know, I think you are aware, but I'm just talking for the general public who's listening here. And then the other part is the treatment part, which is once you have the infection, what medications are given to treat you or fight the symptoms of the COVID-19. So I think we're addressing two parts here. And the industry that I work in is working day and night on both of these endeavors. You might be reading about, at the top of my head, I remember at least 20 trials going on for the vaccination. Recently, we had this data from this company, a biotech which is based in Boston, USA. They had a phase 1 data for their coronavirus vaccine, and which looks really promising.
Yes.
And then, there are other companies that have had, that are working on the data, and the data does look promising. But the nature of, developing vaccine, the process is a little, it's longer, but it's longer for a purpose. Because at the top of my head, I remember that there was a vaccine that was developed for dengue, the infection, and without a lot of testing, it was implemented in the market. And what ended up happening was some of the patients who got that vaccine ended up having a more severe form of dengue. So to be able to bring that vaccination to the market, we have to be sure that it's not going to cause more harm. And in fact, it's going to help people. Right. And that's a longer process. It has to go through a phase 1, phase 2, and then finally, a phase 3, which is a broader study wherein, we use it on a wider variety of people to see how effective it is. Initially, from what I heard, it was the tentative timeline was from the beginning of the phase 1 to 18 months following the beginning of the phase 1 trial. And I do know that the trials began sometime in Feb. The first trial began sometime in Feb 2020. So if we calculate from there, 18 months. But now with the promising data that we are observing with a few of these vaccines, some of them might get fast-tracked. There's always ifs and buts, but from now what I'm hearing in the industry, they say sometime spring of 2021, which is sometime around March, April, we might have our first vaccine. Fingers crossed. It's a very dynamic field, so you never know. But if it does, that's going to be really good. So that's the vaccine part. Correct. Talking about the treatment parts, you did talk about remdesivir being approved in this indication by the FDA recently. And then we have a lot of other trials that are going on. My company that I work on is also, doing their own trials. Regarding the availability of these treatments into the developing world, I, as a professional, do not have the ability to comment on this, but I do have an opinion that when it is a pandemic, it's not located in one particular geographic area. It is in the best interest of public health, of the whole global world economy, help everybody, that this medication be widely available, irrespective of the developed versus developing world. Because as we see, the origin of this virus was from China, and it spread all across. So it is imperative that we provide all the medications all throughout the globe, so that we can help fight this pandemic. all the countries are in it together. So it's not, we don't have to be specific to providing a medication to a particular part of the world.
Well, the reason I asked, sorry to interrupt, but the reason I
Yeah.
asked is because of the, a lot of people in developing worlds, and especially our audience is also in those countries, including Afghanistan, their hope is to, the developed world, and when is the medication coming? And some people even have the understanding, maybe it is, I don't say it is right or not, but it is, people will, it will go to the first, as so-called first countries, which I'm really against first, third, second countries.
Right.
But it is going there, like as public health professionals, to us and health professionals in general. Health of every human being is important for us, and especially with the pandemic being, a lot of people are, almost the whole world is suffering. That is obviously going to help everybody across the world. But again, it's really, I really appreciate the work that everybody's doing in terms of working together to bring this COVID-19 to an end, and hopefully the vaccine and medication will come out soon. So there are steps actually going through, that we are going through these different steps that as we are fighting with the coronavirus. We started with quarantining and all that, and social distancing as we learn along the way. And the containment and mitigation phases were successful so far. And the number of confirmed cases as well as mortality rate has significantly decreased, which is a really good news.
Right.
Now that we are preparing for reopening, some states has already reopened, and some parts of the world, other countries also have reopened. What is your recommendation for people at this point, and how long do you think will it take for the public areas like movie theaters and restaurants and those places to fully function?
Oh, I would love to go to a movie theater today, but
yeah, we all do.
Have to.
I need a haircut, and I still haven't been able to.
I know. Yeah, it's just a new way of living now.
Yeah.
And that's actually a very, very good question, Hamid, because to a common person, we were used to living a certain kind of lifestyle, and that's completely changed. And that's the first question that comes to our mind: when do we go back to our previous normal? The basic answer to this question lies in the data. Correct. For each state, they are in, each part of the world is in a different, position in terms of the data. Every pandemic has, it starts, it reaches its peak, and then the decline starts. Correct. There are some parts of the world which have already seen that peak, so are on the decline now. The cases are reducing. Case in point, New York, New Jersey, the cases have started to decline now. So there were other places like, I think Europe, they had their peak before us. China had even prior to that. So we have to, the data tells you when the peak is coming. And once we've reached that peak and we start to see the decline in the number of cases, that's when the reopening strategies come into the picture. And always, as always, it cannot be sudden. We just cannot go back, once we start seeing a decline in the number of cases, we just cannot go back, the next day to whatever our normal was. Yeah. It has to be in phases. We did not get here in one day, so we cannot get back to our previous normal in one day. It might, in really severe cases, it might even take a year or so to return back to, and case in point, if we have the vaccine, if we have proper treatments available, that's when I see that, our previous normal might come back, but maybe in a year. And, reintroduction to society has to be in different phases. As you're aware, you're in New Jersey. We are in phase 1 now, where our governor just announced last week about, previously we were not allowed, there was no social interaction allowed except for your family. But now we are in a phase where a group of 10 people can collect indoors, and outdoors, the limit is a group of 25 people. But even then, there is a caveat of practicing proper hygiene, washing your hands, and trying to use masks if needed. So that's our phase one. Once we introduce phase one, even during that phase, work from home is highly recommended unless you are a worker that's needed on site. Even then, you have to have a minimum number of people on site. You cannot have, a lot of people together.
Right. Mm-hmm.
So once we introduce phase one, there'll be a revisiting of the data during that time to see how, how we are doing in terms of new cases. Texas did that. They did their phase one, I think, a couple weeks back, but they are seeing a little bit of an increase in the COVID-19 infections. So they might have to revisit their strategy.
Mm-hmm.
But once we have phase one, and if we do see that we are doing really well,
Mm-hmm.
we might move to phase two. And I think for us, I don't remember all the details, but that's when, outdoor restaurants with outdoor seatings can open up.
Mm-hmm.
Indoor is still not allowed. You would have outside seating with 6 feet of distance between the two tables. So there are stipulated guidelines. Even then, work from home would be highly recommended.
Mm-hmm.
And then talking about the movie theaters and the sporting events, that's phase three. So once we have phase two, revisiting the data, seeing if we're doing well, that's when phase three comes. And if I were to calculate, I don't see that happening till at least spring of next year.
Mm-hmm.
I would love to be proved wrong, but this is my, calculation based on what I'm seeing right now.
Well, great. Thank you.
Mm-hmm.
You pointed out and laid out really clearly so that the audience can know what to expect and exactly with the phases. It's really important, as you mentioned. It took us a lot to get to where we are now in fighting COVID-19, and people need to stay more patient and vigilant as we are, hopeful that the curve's already flattening and we'll get to the other side of it and get rid of the virus. But meanwhile, we all need to be very patient in the process of going back to normal. Which this leads me actually to the next question, that people are actually starting to come back to work in some parts. As health professionals like myself, I've been working throughout this pandemic. I had to go to the office as an essential worker. There are people who are working at their offices, people who are working from home. And it's been challenging for some people to work from home and to adapt to such new norm or changes. And people are some parts of the country and are coming back to work, going back to the offices, and some warn like potentially another wave of coronavirus in the fall. What will prevent it from flaring up again as soon as people are going back to living the way that they were before?
Right. Yes. So for that, I don't think till the time, as you mentioned, we'll have the flu season in fall. So it's going to be flu season along with COVID-19 now. So it's going to be double the impact. I don't see us going back to work the way we were used to till the time we have a clear-cut, vaccination, a strategy in place. We will have to modify. And I do hear, and I'm a part of, a few groups where these discussions do happen. There has to be a change in strategy in terms of the companies that are letting people come back to work. There are certain workers who do not need to be on site. So it is recommended, and I think the guidelines will come out soon, but it would be recommended to let those people work remotely if their job does not entail being on site.
Correct.
Secondly, there might be people who would be needed to be on sites. There might be a staggered approach that would be followed. We might have to do with shifts to avoid, big groups of people coming at the same time. So that might be a strategy that some companies can implement, having, people come in different shifts. Another strategy that I think some companies have started implementing, and I don't remember the name, but I do remember reading about it. They've divided their staff into different days. So, a particular team comes, so say on a Monday and Wednesday, and then the other team would come on a Tuesday and Thursday. And in between, there's good sanitizing, everything's cleaned once a particular team comes in, and then the day after. So this is the time to innovate and come up with newer strategies, which would help, best adjust between the work and also, the public health. So we might need newer strategies. Another aspect nowadays is a lot of bigger companies, they have this open work environment. It's like a big thing, it was implemented over the last few years, where everybody's sitting in this open work environment, and it was considered to be, the thing to do. Every company was following it. They might have to rethink that strategy, given the current situation. I was reading about, setting up sneeze screens is what they're calling them, like 6 feet tall sneeze screens. So all of that. And then, temperature checks, having, again, contact tracing, isolation, all of those strategies will have to be implemented in a stringent manner if we have to introduce, if we have to go back to work. These approaches will have to be implemented, and it's not going to be the way it was till at least, I'm thinking, early next year.
Well, great. Thank you again. Yes, as you mentioned, that we have to have new strategies and in place and we have to be prepared for when people are going back to work, even if it's when we earlier talked about the restaurants, same thing, like, when people are going out, if not even only work, but any other, social gatherings or outside in the public. I've been interviewing people from across the world to learn from one another. And the whole purpose behind my podcast is also to bring experts across from, the world to share their experiences so that we can learn from one another. And yesterday, I had an interview with a health expert from Germany, and he said that in Germany, when the restaurants reopened, they asked the people to write their names, their phone numbers, and all their kind of like identification to when they come and eat at the restaurant. So in case if something happens, a positive case or something, so they can have a way to do the contact tracing and stuff like that.
Right.
In a normal day, it would be very weird to do such a thing, but we have to adapt to some new changes in order to be safe. And I think we will have also, I don't know, there will be new strategies, as you said, in the US and across the world, as we are trying to reopen and going back to normal, which a lot of people are impatiently waiting for that, but we have to be patient.
That's true.
So there's like, I don't know, some people have this kind of understanding that and believe that hot and humid weather will kill the virus. And what's the latest scientific research on that? Like, should people believe in this?
Initially, yes. From the way we were observing the pattern of the spread of coronavirus, this novel coronavirus, it was targeting countries which had a colder environment. But from the data that's coming in, Brazil has cases that are rising, India has cases that are rising, and it's pretty hot there. So as of now, we don't have a final verdict. But from the way the trend is, it does not seem to be supporting the fact that hot and humid weather, is going to kill the coronavirus or something. So we should be skeptical in assuming this. As I mentioned in the beginning, it's a novel coronavirus. We don't know a lot of things about this virus. But from the data, it does seem to be, targeting all the countries irrespective of the weather. Let's see as more data comes in. But right now, it doesn't seem to be the case.
Correct, correct. Great.
Mm-hmm.
Thank you for making that clear for our audience.
Mm-hmm.
For the sake of time, I'm going actually to the very last question. And this question, I want you to have like, a little more detailed answer for this, because coronavirus has impacted people's lives from, different angles. Obviously, it has affected people's physical well-being, but also mentally people are at an unprecedented stress. And could you please talk about mental health aspects of coronavirus and how people can cope with it? I know you have been talking recently about this to raise awareness.
Yes, exactly. And I remember, Hamid, talking to you a few days back and how we were discussing that a state of well-being is not just your physical well-being, it's
Exactly.
the emotional, social.
By definition, that same thing, yeah.
Exactly. So, thank you for asking this question, because this is a topic that's very close to my heart as a public health worker, as a human being in general. We have had epidemics, pandemics in the past, but this one is a little unique because of the fact that we have adopted these very stringent social distancing measures. And because of these stringent social distancing measures, there is a mental health aspect that's actually higher now than as opposed to what we've seen in the past, because it's not just about not being able to do what your life's normal activities, being able to meet with your friends and family, go to the mall, but there's also the aspect of people losing their jobs, their livelihood. They cannot go out and earn, so that adds another mental burden, along with all this the physical burden of seeing all these infections rise. My thought process is, when something like this strikes, it's always good to go back to the basics. And when we go to med school, we kind of read take care of your body, take care of your mind. It's all a holistic approach. When we go to public health classes, there is a separate section where we do talk about a healthy mind, healthy body.
Correct.
So that said, in order to focus on our mental health during these times, there are two aspects. The first one is taking care of your body. And I cannot stress enough, and you as a healthcare professional, you're aware that these are the times when we are sitting at home, not having a lot of social interaction. So it's very easy to fall into the trap of eating junk food, not taking care of your diet, just falling off the curve. So we have to be cognitive and more conscious during these times. Regular exercise. Luckily, we are in a country where, keeping our social distance and going out for walks or maybe like a bike ride is possible. But even if we are in a developing world where, that's not possible, there are so many things that we could do indoors to engage in some kind of physical activity. Try doing that. Try to, there's a lot of aspects, I could go on and on, but I think in a nutshell, it is taking care of your body, doing all the good things that we are used to, and not falling into the trap of, into the loop of, oh, I'm just sitting at home, there's nothing much to do. Let me just, start binge eating and not taking care of myself. The other aspect for mental health is your mind, how to take care of your mind, keeping a healthy mind. Having a positive outlook in life. We see a lot of news nowadays, and frankly, news talks mostly about, if they were to tell you the world is amazing and, everything is nice, you would watch it once and then you would just turn it off. But the fact that, they have to show you the picture where the infections are rising, just to make you more conscious, to make you more aware, that's how they're generating their ratings, and people are watching it for that. Once we keep watching such news channels and all this news, it's very easy to fall into the trap of a negative frame of mind. The world is going to end, everybody's getting infected. In the US, there's destruction everywhere because so many people, these are my parents who live in India. These are their views when they watch the news channels for too long. it is good to stay aware, but we need to know when to switch off and when to understand that this is going to affect our mind and our mental health. Relying on reliable sources for our news. In general, connecting with people. We are in a world, you and I are doing this podcast right now, which I think in the last pandemic time, which was sometime in 1930s, wouldn't have been possible.
Yeah, of course. Yeah. With the technology and everything now evolving and changing, we have a lot of tools to stay connected.
Exactly. So let's use that for to stay connected with people, cheer people up, just be in a positive frame of mind. And just pick up projects. There might be something that you've wanted to do, and this is the time when you're locked down in your home, you don't have any other avenue that could give you a sense of achievement once you complete that. So all of these combined, you have to be aware of when you're falling in the loop and to be able to correct yourself. And once you do, staying positive, taking care of yourself, all that combined is going to have a positive effect. We have to remember, at the end of the day, nothing lasts forever. We are in a phase. Everybody's working on, getting us out of that phase. But till then, we have to be aware not to be so negative that it has long-term effects on our body, on our mind, and we just have to stay positive.
Exactly, as you mentioned about the technology and everything, in comparing this with the previous pandemic of the 1918, there's a huge difference. Like, we have to be hopeful, in terms of technology, in terms of medications, in terms of vaccine. Let's just, you just mentioned about vaccine. Let's take that as an example. It's unprecedented, like how soon we are, working on that in the phases that people are working tirelessly to get the vaccine available for people across the world. I think as health professionals, we do believe that the virus is real and it is threatening. But meanwhile, we are very hopeful, and we know that we can overcome this challenge. And people should always be hopeful and look for the better days to come soon.
Absolutely.
For the sake of time, it was a very wonderful time with you today, and I'm pretty sure that the audience will learn a lot from this podcast. I thank you very much for your time and being with us today.
Thank you, Hamid, and keep doing the good work.
Thank you so much. And for our audience, thank you for listening, and please do follow the podcast with Dr. E for more amazing guests to come and talk. Thank you very much, everybody, and have a great day. Thank you, Astha.